Hello friends, welcome to PGDIAMS. Last time we discussed a very important topic of general pathology, that was inflammation and repair. And today we'll be starting with the next very conceptual and important lecture of general pathology, that is cell injury and adaptation. I'm Dr. Preeti Sharma, MBBS MD Pathology. And today, broadly, before we begin with this lecture, let's go through an overview of what all will we be covering today. So this will include cell injury, that is reversible and irreversible cell injury. Under irreversible cell injury, we'll talk about necrosis, apoptosis. Next, following cell injury, we'll talk about how the cell tries to adapt to the injurious agents, that is cellular adaptations. Next, we'll discuss all the intracellular pigments that accumulate within the cells, calcification, which is another very important high yield topic. And lastly, we'll end this topic with cellular aging. So starting with the first topic, that is cell injury. Now, what is cell injury? The basis of cell injury is what we need to know first and foremost. So whenever there is a cell and there is any injurious agent that comes, which can be a wide variety of injurious agents, which we will be discussing shortly, any type of injury that is inflicted onto a cell, the first thing that our body tries to do is adapt. The first thing that our body tries to do is adapt. However, if this injurious agent continues to inflict injury on this cell for a very long period of time, if the injury continues to be prolonged, or if our body fails to adapt, if our body fails to adapt to this particular injury, if the injury is so severe that our body fails to adapt, in that scenario, the cell will undergo injury. So injury does not occur as the first step. The first step that our body tries to do is adaptation. Failure of adaptation, or a severe injury or a prolonged injury that goes on for an extremely long duration, then it would finally result in loss of adaptation, of the loss of the adaptive ability of the cell, resulting in injury. Now, what are these injurious agents that I was talking about? What are the causes of cell injury? So the first cause, which is the most important cause that we must know, is hypoxia. Hypoxia, as we all know, is a decrease in the oxygen level, oxygen at the tissue level. So the first and the most important cause of cell injury is hypoxia. Following which, we can have infections. Now, infections can be a wide variety. They can be bacterial infections, they can be viral infections, they can be parasitic infections, so on and so forth. So any infection can cause an injury in our body. Next cause of cell injury is inflammation. Next cause of cell injury is inflammation. Now, inflammation can be seen following an infection also, and it can be seen along with hypersensitivity reactions. They can be seen along with hypersensitivity reactions. So even a hypersensitivity reaction can cause injury to the cell. Okay, now moving ahead with the other causes. Cell injury can be following any physical damage, or there can be physical agents which are responsible for cell injury. What are these physical agents? These can include UV rays, X-rays, or in other words, this can include radiation. It can include burns as well. So these are all the physical agents which can result in cell injury. Following physical, the next we have other chemical agents. The next we have other chemical agents. Now, what are the chemical agents? Chemical agents might be poisons. They can be drugs. These are the chemical agents which can result in cell injury. Following this, we have other causes as well, like genetic causes. That is, there are certain genetic alterations which are going to result in cell injury. That is genetic causes. For example, like seen in sickle cell anemia. Because of the underlying genetic cause, there is an injury that happens in the cells. So, genetic causes can also contribute to cell injury. And lastly, nutritional causes. Now, what comes under nutritional causes? As thought by many, it is that only the deficiency of certain nutritional elements can result in cell injury, but that is not true. We have both ends of the spectrum that we need to consider. Less and excess of anything is bad, right? So even a deficiency can cause cell injury, and so on the other hand, excess can also cause cell injury. So for example, a vitamin A deficiency can also result in cell injury, and a cholesterol excess can also result in cell injury. So both deficiency and excess can result in cell injury. So this is a broad list of all the causes that can cause injury in the cells of our body. But of these, what we need to know most importantly is hypoxia. Now, what is hypoxia? The first thing, it is a decrease in the oxygen at the tissue level. It is a decrease in the oxygen at the tissue level, that is seen, right? Now, what can hypoxia be due to? What are the causes of hypoxia? The first cause that we need to know is ischemia. The first cause that we need to know is ischemia. Now, ischemia is nothing but a decrease in the blood flow. A decrease in the blood flow. Obviously, if the blood flow to a particular organ decreases, automatically the oxygen that had to be carried to that organ via the blood also decreases. So, ischemia results, that is decreased blood flow, results in hypoxia. Classical example of such a mechanism would be myocardial infarction. When the blood supply to the heart is decreased, the oxygen supply is decreased, that is there is hypoxia, the patient ends up in a myocardial infarction. So the first important cause of hypoxia is ischemia. The second cause of hypoxia is anemia. That is, the oxygen carrying capacity of the blood has now decreased. There is a decrease in the oxygen carrying capacity of the blood. So now less amount of oxygen is reaching the tissues, so automatically the patient lands up in hypoxia. So the first important cause is ischemia, the second important cause is anemia, and the third important cause is any cardiorespiratory disease. What and how will this result in hypoxia? A cardiorespiratory disease will hamper the oxygenation of the blood. Now, adequate oxygenation of the blood will not take place. So, although adequate amount of blood is reaching the particular tissue of interest, but it is not well oxygenated. So, this will decrease the oxygenation of the blood. Automatically, patient lands up in hypoxia. So these are the three important causes of hypoxia that we need to know, which can result further in cell injury. Now this brings us to three very important MCQs that are repeatedly asked. The first that we need to know, which is the most important cause of cell injury? Which is the most common or most important cause of cell injury? The answer to this is hypoxia. The most common cause of cell injury is hypoxia. Now next question that comes is, one step ahead, which is the most common cause of hypoxia? The most common cause of hypoxia. And the answer to this is ischemia. Ischemia is the most important cause of hypoxia, and in turn hypoxia overall is the most common cause of cell injury. Going one step ahead, out of all the organs that we have in our body, which is that organ which is most susceptible to cell injury, or which is most susceptible to hypoxia? So which organ is most susceptible to hypoxia? That is, it would undergo injury within minutes, and the answer to this is neurons. The answer to this is neurons. So these three questions have been repeatedly asked in various exams. So we need to know these questions. Which is the most common cause of cell injury? And that is hypoxia. Which is the most common cause of hypoxia? That is ischemia. And which organ is most susceptible to hypoxia? Those are the neurons. Right? Now following this, let's move one step ahead. What are the types of cell injury that we know of? Okay, now as I said that there is a particular cell which undergoes injury or exposure to any injury. The first thing that it will try to do is adapt. And if it cannot adapt, it will result in cell injury. Right? This is the basis that we had. But will the cell undergo death immediately if there is failure of adaptation? No, that's not the case. First of all, this cell injury, if the injurious agent lasts for a very short duration, it might revert back to the normal state. So initially, this particular process is going to be reversible. This particular process is going to be reversible. Following which, if the injury is very severe, in that scenario, the cell is going to undergo irreversible cell injury. Irreversible cell injury, right? That is, now from here there is no return. The cell cannot return into its normal state as it was before exposure to the injurious agent. And this irreversible cell injury will basically result in cell death. This will result in cell death. And this cell death can be of two types. This cell death can be of two types, that is necrosis and apoptosis. Necrosis and apoptosis. So this is a broad overview of, you can say, the entire topic that we will be dealing with today. Adaptations, injury, reversible injury, following which there can be irreversible cell injury leading to death, and that can further be of two types, broadly of two types, necrosis and apoptosis. So now clearly we can come on to the types of cell injury. So types of cell injury were of two types, reversible